Okay. Thank you for staying with us, but it's not so late, so yeah, it's my next presentation will be about artificial intelligence-based thermography for vascular pathology. I have to admit that I'm a minor shareholder of the Kelvin Health, that is in fact owner of thermography. Peripheral arterial disease is a huge medical problem, not because of itself, but because as well it's one of the biggest predictor of mortality, including cardiovascular mortality. So more than 70% of the patients with peripheral arterial disease die from stroke and MI. So they die because of cardiac and cerebrovascular mortality mainly. And of course, part of them because of the complications of the peripheral arterial disease as such. But the majority of them are dying because of cardiovascular cause. And this is the reason the early detection of peripheral arterial disease is extremely important, because it can prevent millions of lives. Let's speak about the detection of peripheral arterial disease. There, since the Hippocrates time, since the Avicenna time, palpation or skin temperature detection or ankle brachial index. Nowadays, in the guideline is the ankle brachial index. So the measurement of ankle brachial index is considered golden standard for the early detection of peripheral arterial disease, both in the American and the European guidelines. Is it ankle brachial index accurate and precise? It is not. So there are two reasons the ankle brachial index is not reliant enough. First of all, and the main reason, is because the diabetics, huge calcification, the so-called medial calcinosis, doesn't allow to have good and exact measurements of the ankle brachial index. And of course, it's more or less operator dependent. So we need a better approach, we need better method to be non-invasive and safe, to be quick and reliable, and non-operator dependent. It's also important because, for example, duplex is excellent. It's fantastic, but it's time-consuming. Waiting list present in many countries for duplex. It's operator dependent, so not readily available. Speaking about possibilities, one of the possibilities, the thermography. The idea of thermography as a measurement of the health is and the disease is coming from Hippocrates. He told us that should one part of the body be colder or hotter than the other, disease is present in that part. So there are some data about the role of thermography since more than 60 years. And during the time there were some publications as well. But in fact, the thermography was developed because of the mainly for the military industry. And even now we are living a crazy time in which still the military is moving also some innovations ahead. One of the big innovation is exact, precise, high-resolution thermography. And this is in fact the timeline history of thermography since the astronomy and the military industry through the medicine. So in the medical journals, there are several publications showing the role of thermography for detection, not only of infection or breast cancer. In fact, for breast cancer, it's mentioned in some guidelines. In this publication, for example, it was used for the tissue perfusion based on the skin surface temperature, and the result before and after a revascularization on the level of the superficial femoral artery. And it was shown that is quite a good correlation with the ankle brachial index. And also in this publication, there was infrared thermography as a screening method in patients with diabetes. I mentioned already that diabetes, they are very much prone for vascular disease. At least 20% of the diabetics, they have vascular disease. And because of that, for vascular disease, it's very important. In this picture is shown not only vascular disorder, but also infection on the foot. Speaking about the nowadays practice is already artificial intelligence facilitated. So we need artificial intelligence integrated in a simple but high resolution mobile thermocamera. This is the so-called high resolution FLIR camera that is put on an iPhone nowadays, and after the artificial intelligence activation and neural network analysis based on many thousands, I will show, probably I can guess last week we reached 20,000 pictures gathered in the cloud, in the platform, in the digital platform. So based on the angiosome concept and the artificial intelligence teaching what are the patterns of health, disease, and angiosome disease. You know, angiosome is related to the tibial artery. So every tibial artery, there are 3 tibial arteries. Every tibial artery has his proper angiosome. So based on this segmentation and analysis, the artificial intelligence can separate health from disease. We are gathering pictures from 3 continents, and they are including Anna Podlasek. She's the author of a fantastic overview of thermography for brain. And hopefully in several days we are going to send the article for publication, hopefully. And also our friend Alejandro Alvarez from Argentina, and also Professor Bizdes from Greece. All we are gathering pictures into the cloud, into the digital platform. And in 3 minutes, without any additional effort and without any operator dependence or something very complex. So no, it's not complex. There are in fact 5 positions, 1 front, 1 behind, 1 side, the other side, and in front of the foot. These are 5 positions taken in 3 minutes. Of course, in general condition, room temperature, 10 minutes after stopping any exercise. So these are the main conditions. The patients to be at rest, at room condition. These are the only two requirements. We comparing the results of the thermography with angiography and CT angio. So or conventional angiography or CT angio. We have many publications already done, and more than 20 presentations in congresses, including VID Symposium, Link, and so on. For example, can you guess what is the underlying vascular picture? Those of you who presumed Leriche syndrome, you're right. Yeah, this is the picture of Leriche syndrome. It's an occlusion of the aorta. It's occlusion of the aorta. And for example, in this situation, you see the left leg, something is not well. The foot and the leg, it's definitely, it seems, with lower temperature. In fact, it was a very dramatic case in which the manta closure device occluded. You see the metal marker of the manta. A gentleman, young gentleman, that we implanted a stent graft into the aorta because of aortic dissection. During the night, he complained for a sudden pain into the left leg. And in fact, what I have shown was the immediate picture of the leg after his complaining pain in the left leg. After the opening, of course, like I have shown several times, having upper approach from the brachial artery. In 5 minutes, we are going from the brachial to the femoral. And we, of course, succeeded to open the occluded artery and to put a stent into the common femoral artery. And we have full restoration not only on the SFA, but also on the tibial level. You see, all the 3 tibial arteries are patent below the knee. And this is the result. It's full equalization symmetry. The symmetry, it's on the left side is before, and the right side is after. So it's a full symmetry restoration into the legs. This is another case, 75-year-old with complex risk profile, unfortunately with a history of amputation of the left lower extremity, and he presented in critical 4-stage of Rutherford for the right leg. And this is the situation. You see the left leg is amputated, and there is a critical ischemia of the right leg. And there is a very scarce, only collateral feeling on the level of the below the knee, tibials. You see, it's awful, the angio. And this is the thermographic picture. Again, this is after the recanalization, the distal popliteal and the anterotibial. And based on angiosome, we were not so happy. So this is an intermediate result. But this is a patient that is endangered by amputation. And taking a look on the thermography, we were not happy enough, and we decided to continue. And finally, we succeeded to open not only the anterotibial, but also the peroneal artery going all the way down, and high takeoff posterotibial also going almost to the leg. And after succeeding to open the arteries, we succeeded to have excellent thermographic result. You see, it's even more. It's like a hyperperfusion. Because why? Because there is, in fact, a zone of the body that is with preconditioned vasodilation. It's, in fact, a reactive vasodilation to the ischemia. And after opening the flow, now the below the knee zone is even with better perfusion than the calf, than the rest of the leg, because of the hyperperfusion syndrome. It's a relative hyperperfusion. Let's take a look of several examples on the level of the brain vessels. So in this situation, you see that the external carotid artery is almost occluded, almost no flow there, and there is a critical stenosis of the right internal carotid artery. And this is the picture by thermography, face and lateral, so anterior and lateral. What, of course, we succeeded to open. We succeeded to open both the balloon in the external carotid and stenting with full restoration of the right internal carotid. And you see what is the restoration of the thermography. This is back. You see there is a lack of perfusion on the middle part of the face, and also lack of perfusion inside the brain. And you see this is a full equalization of the picture on the intercerebral zone, full equalization left to right, not anymore reduction. And you see in the middle of the face is again, it's like a hyperperfusion. So it's a full restoration of the flow, and it's even beyond, it's more than restored. Okay, this is another critical stenosis of the left internal carotid artery, and this is the acceptable result after stenting. Here is before, angio, and right side after. You see much better perfusion on the tissue level, and you see this is the difference in the thermography, before and after. It's more than obvious. It's more than obvious there is a difference. So we can, in fact, probably, hopefully, not probably, hopefully in the future, we can skip several steps in the clinical journey of this kind of patients before the suspicion to the detection of the peripheral vascular problem. And okay, so as a take-home message, the thermography that is assisted by artificial intelligence is non-invasive, it's radiation-free, it's time-saving, and with the help of the artificial intelligence can be a really early detecting method for peripheral arterial disease. Thank you very much for your attention. Some comments, questions?
I had a question about, in terms of the thermoregulation, is there any kind of numerical then correlation to an ABI classification in that when you see the colors, do you still use an ABI classification or is it just for early detection?
This is very nice question. In fact, we are now we are trying to teach the artificial intelligence about the patterns, which pattern to which condition is corresponding. And we continue also in this direction to have, let's say, stepwise approach in order to teach the artificial intelligence, the brain, let's say, what is critical, what is intermediate ischemia, so to have Rutherford classification also as pattern in order to show and to make it, to recognize and to make some suggestions.
So you'll teach the AI to the classification system?
Exactly, yeah. In fact, we have now more than 500 patients screened, both in health and pathology, because it's also important to show all the possible patterns, or probably close to all possible patterns of health and possible patterns of pathology, because there are variety of anatomy, anomalies, high takeoffs, different angiosomes. So we have, like, it's a big data. It's a big data. This is the new gold. Big data is the new gold. So we are trying, based on the big data, to teach the artificial intelligence to recognize what we want.
Any other questions? No? Oh, yeah.
You've mentioned, oh, beautiful, thank you. Great talk as always. You've mentioned that no exercises before taking the pictures. Any other settings about the room, about how you take the pictures?
Yeah, in fact, I mentioned that it has to be taken on room temperature. It's understandable 20-22 degrees. That is, let's say, the classic maintained Celsius. I don't know Fahrenheit how much is, but it's definitely important, because otherwise, in case the patient is exercised, we can both have negative positive and false positive and false negative results. So because of that, it's better to be at rest. And we have spoken and commented that it can be used also for prediction about the possible role of exercising, because we know medication and exercising is the first step on the first grade of peripheral arterial disease. And in case there is an equalization and a more symmetric picture after exercising, this is probably a good reason to continue with medication and exercising. But in case there is no equalization, to go for a CT or for angio and possibly intervention.
Any other questions?
Thank you.
Thank you.